Welcome in. Thank you for joining us. Really excited to have another alumni panel for our Integrative Health and Lifestyle program. And today that our three speakers who are all graduates of our IHeLp program are going to share their journey and how this integrative training has shaped their approach to care. And I'm not going to do a lot of talking, but I'll be moderating. And I'm going to go ahead and say, I'm going to go through questions. I'm going to moderate a set of questions. And then if anyone attending has questions, you can pop those up in the chat while we do our formal questions, or you can just wait until the end when we can have people actually, if you want to come off camera or come on camera and unmute and let us know what your questions are. So I am very excited to have Monica, Sandy, and Deborah here with me today. So I'm going to go ahead and you can see we have in the house representing 2 PTs and 1 OT and a variety of graduation classes. Sandy from 2018, Deborah from 2019, and Monica just graduated with our current 2025 class. Let me go ahead and stop sharing and end that. And what we like to do is spotlight our panelists. So let's get those folks spotlighted. Thank you. Get everybody up here. Thank you, Morgan. Appreciate your help on that. And we'll start with a real easy one. I'm going to start with Monica. Tell us a little bit about yourself. Where are you joining us from? What's your professional background, and what are you currently doing professionally?
So thank you so much for inviting me to this. I am joining from Tucson, Arizona. Yay, yes. I've been a physical therapist for 30 couple years and have worked in different parts of the country. Always like to think I incorporated a lot of lifestyle or holistic care in what I was doing. And currently, I'm now working at the University of Arizona as a faculty member of our new DPT program. So I'm very excited about incorporating what I've learned from the Andrew Weil program from IHeLp and bringing it to our future clinicians.
Thank you so much for being here. Sandy, tell us a little bit about yourself.
So I'm also a PT. I graduated with a BS in '86 and then went back for my transitional doctorate. I think I got done with that in like 2009. And then I went ahead and got my OCS. So I'm a board certified orthopedic clinical specialist like Monica. I am a certified lymphedema therapist and also do advanced vestibular diagnostic work. And I teach a class on lymphatic techniques for people that don't have cancer-related lymphedema. I started this study down a rabbit hole, and one of your MD graduates, Suzanne Bartlett Hackenmiller, who wrote the book on forest bathing, was in Cedar Rapids. I'm in Cedar Rapids, Iowa now. I've kind of been all over the place, but Cedar Rapids. And Suzanne was here, and I started attending lectures and classes from her, decided this is what every PT needs to know. This really gives us the rest of the story because we are about helping the whole person be better. And I mean, PT is about lifestyle medicine, right? It's just kind of what we do. Everything I did in that IHeLp program, I'm like, yes, 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 this is what we do. This is what y'all need to know. So anyway, I love it. So professionally now I own a private practice, and there's I have 1 OT and there's 7 PTs. And we try to all practice what we preach and give very advanced care to our patients, including lifestyle management. So.
Wonderful. Thank you for being here.
Yeah, glad to be.
All right. Deborah, tell us where you're at or what you're doing.
Well, I am currently calling in from Michigan, although in this past year or two, our lifestyle has been pretty nomadic. So I go back and forth between Oregon and Michigan and New Hampshire. Um, and I'm an occupational therapist. I have been so for 40 years, so that dates me. And as noted, I did the Integrative Health Fellowship in 2019. At that point in 2019, I'd spent most of my career in pediatrics, and I had a clinic for children, and I specialized mostly in neurodevelopmental disorders and sensory processing and social emotional concerns. And at the time I went into the IHeLp, my husband was just completing his fellowship in integrative medicine as a
Mm.
PA through the program. And, we were just trying to re-envision where we were going in this next stage of our adventure. Little did we know COVID was around the corner, and that also moved things forward. So currently, I have a practice with adults with neurodevelopmental disabilities through vocational rehab. And so I work a lot on all the principles that we learned in IHeLp in terms of how to help the whole person be able to navigate life in order to be able to navigate the workforce and address pretty complex concerns. And then I'm also in the process with my husband of designing an online program, which will be starting next year, called My Health Compass, which is going to be all about health information and programs and practices being accessible to people. So
Mm.
that's kind of an exciting new adventure.
It's awesome. Thank you so much. And thank you for being here. I should probably have started out by introducing myself. I'm Molly Burke. I'm Director of Online Education here at the Andrew Weil Center for Integrative Medicine. And I also am Program Director of our Integrative Health and Lifestyle program that we lovingly call IHeLp. And just always excited to be able to just hear, what happens when our students complete the program and get to really apply what they've learned to themselves and to their profession. Deborah, I'm going to stick with you on the second question. What are one or two elements from IHeLp that were most meaningful or impactful to you personally?
Okay, well, from a personal perspective, at the point that I was in the IHeLp program, I'd been in practice for 35 years, and I was feeling a bit burned out. I also recognized that I really needed my own self-care, but I'm much more disciplined about my work life than my personal life. So I thought, well, what better than to join a program where you had to do your own self-care in order to be able to share that with your clients. So I found that part very helpful. And at the time I was immersed in it, I was studying to be a medical Qigong practitioner, and I was taking hypnosis, so classes. So all of these things were part of my a personal search first, and then looking at how to apply them so that then I could be more fully present and there for the clients that I was working with, and not just from the information perspective, but from the personal experience. And IHeLp really, really asks you to look at how does this apply to your self-care.
Yeah, great. Thank you so much. Monica, what about you? One or two things from IHeLp personally enriching?
Yeah, well, and similar to Deborah, the self-care, which we're all really good at maybe professing to patients, we're not always so good at doing.
Mhm.
I mean, I think that one of the biggest things is it just reawakened the intuition that comes about that healing is personal.
Mhm.
It's relational, and it's rooted in connection, and it's rooted in lifestyle. And so for me, that was something what I really appreciated, because like Deborah as well, I did different things, had studied hypnosis, motivational interviewing, because I always felt that I might have had the tools that the patient needed, but I was maybe running up into some beliefs, or there was some behaviors I was trying to work around for them as well. And so I love the part that motivational interviewing was covered in this program, as well as the evidence-based, because there's a lot of information out there, but we're really, with the IHeLp program, they're really bridging the gap between what's emerging in the evidence in lifestyle medicine, but it also gives that practical application. And I think that was really important. I still remember Dr. Weil coming on and doing the 4-7-8 breathing. And I thought, okay, this again, but it was so valuable, because we need that. And
Yeah.
it's still something I do, especially if I wake up in the middle of the night. It's still something I'm like, okay, go to that breathing.
Yep.
So I love that it had the science and the practicality, to me. And then, of course, the whole anti-inflammatory lifestyle that really spread across the gamut of all the components. I think that was just so valuable. It was so inclusive of so many things. It had great value, and it really empowered me. So that's probably more than one or two elements, but
That's great. I really appreciate it. Sandy, what about you?
I have trouble narrowing it down to one or two, but I think it's really funny because maybe PTs sort of navigate the same way. But 4-7-8 breathing was awesome. Really just the whole pillars of health concept. I did go into it, personally, and I came out, I felt with like better focus on nutrition and supplementation. I loved Dr. Weil's food pyramid. I still share that all the time, but the breathing, the food, the supplements, plus, I mean, there wasn't anything I didn't like. There were some things I was better at than others. Motivational interviewing is still a struggle for me. I need like a whole semester just to beat the stuff out of my head, but sometimes I'm able to slip into it and do a better job. But yeah, it's just, I loved everything about it. We were talking earlier, I just, I took the deep dive on every single, anything else that was attached. I read it, I loved it, I took it in, discussed it, and it helped to have Dr. Suzanne Bartlett Hackenmiller to be a mentor and someone that I could bounce things off of. And so that was super nice too. So personally, I grew a lot with the program.
That's awesome. So I'm gonna stick with you, Sandy, and say like, okay, we've talked a lot about like personal health, self-care, which is so critical. It's woven throughout the entire program to address those 7 core areas of health. But what about professionally? What are a couple of things that you were like, I definitely incorporated these professionally?
I kind of mentioned those as well, but I do teach the breathing. I do go over the diet. I have an entire section. They give you those handouts that you can personalize at the bottom for the practice. It still says the IHeLp program at the top, but with the logos. I talk about those fundamental options a lot with, rotator cuff people coming in. And, one of the things that got me started with this is patients would come in and you're like, okay, well, they have the same diagnostic problem. Why does this person get better and not this person? And when you've been in it for a while, you're just like, it's like, is it me? What am I doing? Whatever, and then when you start to see that bigger picture, is it diabetes? Is it the stress in their, are they overworking, all the things. And I felt like professionally, having gone through the IHeLp program, it taught me new things. It reinforced things I already knew, but I felt like having this under my belt and being able to say to people, I have a certification in integrative health from University of Arizona, gives a lot of credibility to my ability to chat with them if they want to hear it about lifestyle management. So I think for me to have the credibility to use all of these things that Dr. Weil and the whole program put into play, they matter every day with what I do. So it's not just one or two things, but the 7 pillars of health and the diet, the anti-inflammatory food pyramid are probably my 2 most frequent go-tos. So
Oh, I love hearing about how it's just a part of what you're doing.
yeah.
Yeah. Deborah, how about you? Professionally woven in.
Yeah, actually, it's become in the last couple of years almost the basis of what I do. So, I currently, when I work with clients, I'm working with folks who are having challenges with executive function,
Mm.
challenges with emotional regulation and stress management, and like social engagement and some of those pieces. And the tools that that we use when we're looking at integrative health allows us to look at all the aspects of lifestyle that research says contributes to improvement in these things. And that includes sleep. It includes different methods for managing stress. It includes nutrition. It includes more of the mind body aspects of things. So combining that also with, I think I always felt like I was listening to people and drawing out their goals. But once you immerse yourself in motivational interviewing, you can become more skilled. It's still a work in progress of really digging out from your clients what it is that's meaningful, and what readiness they have for change and where they want to start versus what, my insurance company thinks should like be the list of goals. And like, of course, you have to merge those. But anyway, that's another story. So that's how I'm using it. And I find it really exciting. I don't look at how someone's performing a task or how they're managing depression or anything without actually looking at all those other pieces now and really helping them to explore that and what changes might support them.
Amazing. It's awesome. Thank you. Monica, I mean, clinically, but also maybe in your teaching.
Yes, actually, would love to share some things. I do still see some private clients. So, of course, they either hear from other people or I've seen them before. And, addressing chronic disease through lifestyle medicine is key, particularly when we look at the epigenetics, right? We know that there's influences on our genetics. We know that there's the inflammation and how it affects our body. So, luckily, my clients are open to that conversation. I think in another realm of that, if we embody the work, we can influence. I like to think we can influence those around us, right? In healthcare. And so I think that's a really important component. Going back to the self-care, going back to incorporating it into our own lives, then people hopefully see something in us, whether it's energy or the vitality. The most exciting thing I wanted to share, though, was something I did my project on, and we've already incorporated it into our orientation for our grad students. And so we've got IRB, and we're looking to do more research over the next few years. The goal is really to teach the students, not only for themselves, to teach them resilience and the self-care to prevent burnout, because that's a real thing. Hopefully then they share that information. So down the road, we're going to be looking at, is this something that once they've learned and it's just some part of what they do, then how does that impact their patient care? Because I may sound a little, it may sound a little corny, but I think when people are at their most whole, whether they're dealing with pain or disability or what have you, and they're focused on, there's a term called salutogenesis. If they're focused on health, no matter where they are in that continuum, they can live their greatest potential. And I like to think that changes the world. a little bit in a small little place. So I'm real excited. I hope to be, invited back at some point and sharing some of that research that we're doing with our students. So.
Yeah, no, I'm really excited about it. I loved reading your graduation project. So one of the things that I help students do, or they show how they're going to apply some of what they've learned to real world situation, like a real need, and how can we use this? So, and it's reflective as well as how we do self-care. We want our students to not just read about sleep and health or environment and health, or we want each student to address their own well-being through assessing that area of health, thinking about what small behavior change could they make that would make that area of health even more satisfying for them, right? But then, like to your point, Monica, modeling. Right, we do this number one because our health professionals are burned out or at high risk for burnout, and they need to take care of themselves. But number two is to model for their colleagues, model for their patients, model for family and community. And it's a very powerful tool. And then the final thing is to also increase empathy, because all our students recognize, wow, it can be really difficult to make even small behavior changes. And what are those things that are getting in my way, or what are those value conflicts that I need to reckon with? So I just appreciate all the examples that folks are giving. I'll move on to we'll start with Deborah on question number 4. So for occupational therapy, the field of occupational therapy, what do you see as key benefits for someone completing the Andrew Weil Center's IHeLp program?
Well, I think as a profession, occupational therapy has always stated that it looks at the whole person, and it looks at all the domains of people. And, traditionally it defined those as, physical, cognitive, sensory. I think that this multiplies that, because it's looking at what are the tools that can contribute to development in all of those areas, and just in the general health. So like, I wasn't trained when I was in OT, I did a bachelor's and then a advanced clinical master's. We never looked at diet. We never looked at sleep, right? And yet, for example, in pediatrics, the sleep was a huge problem, not just in pediatrics, but in individuals with neuro differences. And so not having access to all of that kind of information, and being able to really even be more holistic than I was taught even initially as a profession, I think it fits really, really well with the philosophy of OT. And I would say PT too. I'll let the PTs speak for themselves, but I feel like over the 30 or 40 years that I've been in this field, all fields are moving towards looking like at a whole person practice, which means we overlap a lot. And sometimes that can be confusing, but mostly it's for people's benefit.
Yeah, thank you. Appreciate that. Monica, tell us your perspective on physical therapy and that field, and how doing a program like IHeLp would be beneficial.
I think and forgive the saying, it's like one-stop shopping. Like, I've gone to nutritional courses, and I've gone to, maybe a particular type of craniosacral course or whatever, but it's all in one place. And I think that is very helpful. And again, it's evidence-based. I think the public is it's aging. We are aging as a whole. And then, but we're also, I think, because of copays and insurance. And if people are paying out of pocket, they want someone not to just problem solve. They want someone to partner with them. And I think partner in the sense of they're looking for information. We can make a huge difference because we know that people will listen to us. Sorry, there goes my boss. um, um, but we know that people will listen to people that they have a relationship with, that they have rapport with. So if I have concern about a student and I think that maybe they need to see our mental health counselor, if I have a relationship with them, they're going to more likely follow through. We know that. So as PTs and OTs and speech as therapists, we have usually many visits over time, right? Hopefully if we're lucky. And so they're looking for us to partner with them and to know what they need. So we need to know what's out there as well. If we can't offer it, we need to know who can. And then I just wanted to say, it's not about doing more, because I know sometimes when people think, well, then I got this to do and that to do, it's doing more what matters, right? And so again, if someone's having trouble with a chronic disease of some sort, if we can make a small difference in getting them to plant that seed, I think that is really important to the future of PT as we incorporate where it's in our scope to educate patients about nutrition. It's in our scope to educate them and to treat them from that mental health perspective. And as Utah just passed the law to do primary care, not to be a physician, but to be primary care, it's going to be more and more important for our future clinicians to know about these things that are going to help people. So
It's wonderful. Thank you. Sandy, your thoughts?
So many. First of all, I want to say to any PT or OT considering taking this, I found that the whole program was very validating. It was like, yeah, that's what we do, or I need to know more, like it helped me dive deeper. I learned so much that I had no exposure to, or things that I thought I knew, I found out I needed to know more. Like the more you know you don't know. That's kind of why I have a lot of letters after my name. You just kind of keep deep diving. But I felt like this was energizing to me as a career. It allowed me to be able to understand people more deeply. And one of the things that I really like about, you'll see a lot of overlap, but there's functional medicine programs and there's integrative medicine. And what I found that made me as an evidence-based practitioner feel the best about this program is that integrative health, I see it as a yes and. We're using the evidence. We are not throwing out Western medicine. And we're saying, yes, you might need some medicine, but let's add some lifestyle in and maybe you can get back off of it. Or before you jump into just taking medicine, here's some things that might help you feel better. Or it just gives you the tools to discuss the elements of their health that may be impeding their recovery. And it makes me feel confident that I have the knowledge to give those levels of advice. And I have an entire drawer. If I can't provide what they need, I have the referrals. I have an acupuncturist. I have a physiatrist. I have, women's, like just all the stuff, because we are full beings. And I see myself as a portal to feeling better. And even if it's not me or someone within my practice, we have so many specialties within my little space. But the integrative health training that I had, it gives you the confidence and the knowledge. And even if it at least introduces something and allows you to see, do I need to go further or do I need to find somebody that's better at it? Like we got on that section on Ayurvedic medicine and I was like, oh, I love this stuff. And I got in there, I'm like, oh my God, this is really hard. So if somebody needs it, I send them out. I know enough to know that's beyond my return on investment at this point in my life. And so I think it's cool, but So, but I feel much more knowledgeable about so many things. So, see if there was anything else that I would say. Um, I think I said most of that. I did not at the, at the time. So, Deb did go on and become a health coach. I would say if you only want to do this as a PT, it's still not reimbursed under insurance, but it's still, I use this approach with everybody that comes in. I have some people that just want to sit down and talk supplements. And so I have a private pay fee. We'll sit down, we'll go through all those kinds of things. But otherwise, it goes under patient education for lifestyle improvement, and that is reimbursable. And you can fit it all in. You can do exercise, and you can still be talking about what is going to help them. You can document it. It's evidence-based practice. And in Iowa, we are full direct access practitioners. And so again, it just allows you to go a little bit deeper. Sometimes back pain isn't what you think it is, right?
That's great. I love that you're like, here's like also the practical side and also like at the heart-centered side, right? It's
Yeah.
like, and it's one of the problems, right? Like we all recognize that our healthcare system is broken and we're all trying to work within a broken system. And what do we have control over? And, really reigniting that passion in folks is why did you get into healthcare? Why did you want to care for people? And how can you connect and partner with folks? And you can make a difference in 5 minutes with the way that you interact with someone.
100%.
Well, it's just like you said, a breathing technique. Hey, we could carry our breath with us. It seems too obvious, but like I'm going to show you how anytime you can reach in and use that.
Right.
And I love hearing from you all. And of course, the one of the guiding lights of when I was designing IHeLp was all healthcare practitioners, if they were all coming from an integrative perspective and had some of these tools in their toolkits, they would be able to do so much working together across disciplines
Right.
to make a difference, not to the patients, but I also hope to healthcare.
Right.
And hearing from you guys, it was an interprofessional program. There's over 30 different professions represented in our alumni groups. And I just see how referring out, connecting with others, being aware of what to talk about, but then also not trying to like learn every single modality in the world, because there's other people that you can get help from with that, right? It's wonderful. All right, this is where the time where we actually get our audience gets to ask questions and not just me. It looks like we have a question from Devanshi. Please, if you want to get on and ask anything, but it says, I've been interested in integrative health for a while. Curious, does the Andrew Weil Center have a relationship with the AOTA or APTA? I'm going to guess those are professional organizations that I don't know and don't have a connection with. So I'm going to say we don't have a relationship with that. I'm looking at my panelists and getting confirmation. I'm guessing, but something to look into. We don't offer, just like as a maybe a relationship to why you asked that question about continuing education credits. So I will say that we do provide continuing medical education credits and continuing nursing education credits. A lot of our students will take those CME credits and go to their boards and say, hey, this was approved. This is the topic. This is why it's important for me to use.
I had no problem using all of my IHeLp training towards my licensure requirements. It was, way over the top what you needed, but it was accepted.
Awesome. Great to hear that. Jennifer asks, can you explain the difference between integrative medicine and functional medicine? I can from the Andrew Weil Center standpoint, but I think they're here to hear from you all. Sandy, you're the one who brought up the two terms. I don't know you want me to respond, or if you want to?
Let me
That's
throw
all.
in what I think and then you straighten it out. Maybe. I don't know. I think you
We're
probably,
just different. Who knows?
they are different. In my quick summary, it was that integrative is yes and. We accept evidence-based care and what we see as Western
Yeah.
medicine, but we know that these
Yeah, I think I
complementary.
was supposed to be in one now.
Sorry, I got it.
Oh,
I gotta keep going.
okay. So anyway, so integrative accepts that complementary approaches to lifestyle and health do have evidence to show that they make our traditional approach to medicine better, and they work together to help somebody recover and stay well. Whereas what I have seen with functional medicine, it's sort of like, you don't need chemotherapy, you can cure your cancer with diet. You know, it replaces what we would see as evidence-based care. So that's me. What do you say?
Well, I've never seen that level. That is definitely a red flag. If anyone, functional medicine or otherwise, is like,
Mhm.
oh, this is equivalent or better than chemotherapy. That
I
definitely
have a
integra-
friend who's dead because of that.
I'm so sorry. It is
Yeah.
right. And it's so another thing is always tricky about integrative medicine and functional medicine is who's calling themselves what and how
Yep.
what's their true education, where's their
Mhm.
practice.
Yeah.
But the way that I'll kind of summarize functional medicine is they're very focused on testing and kind of an algorithm based
Mhm.
on testing and gut
Mhm.
microbiome. And there's some of those tests that are show some potential,
Mm.
but a lot of them aren't tested. And so and then you'll see that now they'll say they're integrative functional medicine. So
Mhm.
they'll say they follow the integrative medicine philosophy and then use functional testing. And I'll just
Mhm.
say we don't teach anything functional in IHeLp. And so if you are interested in a functional training, we aren't the place to be, but yeah, we will definitely both support Western, yes, and I love it, complementary natural healing modalities, lifestyle approaches, and really what's at the core, what's most important to that patient, and what do they want to make changes around. Thank you. All right, you referred to the breathing strategy. Can you please describe it? Oh, 4-7-8 breath. Does anyone want to teach the 4-7-8 breath right now?
Anybody? You go, Monica. You're the newest grad. You're an instructor. You can. We use it all the time, but
Any different, I'd just like to preface, we learn many different breathing techniques. For those of you who have a little trouble holding your breath, this might be a little bit more challenging for you. So you opt to choose for yourself and make decisions for yourself. So the 4 would be, I'll talk you through it and then we'll go through it. The 4 is an inhalation, the 7 is a hold, and the 8 is an exhalation. And we know that longer exhalations tend to create more of a parasympathetic mode in our nervous system. And most of us don't quite breathe like that. So if we try it together, we'll inhale for 4, hold for 7, and exhale for 8. If you'd like to try once more, inhale for 4, hold for 7, and exhale for 8. 2, 3, 4, 5, 6, 7, 8. So the recommendation is you start with 4 cycles. Do that for a few times, twice a day. I like to say I bookend my day with my breathing, intentional breathing. And then you can work up to more cycles, like cycles of 8.
Thank you so much. I appreciate the demo, and it was a great question. And yeah, just to add on to that is a structured breathing technique. We do teach a number of them, and there's bottom line, just becoming conscious of your breath. Just step 1 for people that can really open the door, but it is nice to have that structured breathing activity so they can go like, hey, this is a real, this was a real exercise, and I can think about taking time out to engage that muscle of breathing. So thank you. And I want to say, Andrea, you have your hand up. Go ahead and unmute and let's hear your question.
Hi, good afternoon or evening or where everybody's from. I wanted to say thank you. Like, I really appreciate what each one of you are doing. It's great. But my question kind of, I think, is more directed to Deborah. And you mentioned about neurodevelopment disorders and how you're working through that with adults only. Have you thought about pediatrics? And I kind of intrigued about your outcomes on how this has developed with that, because I'm currently dealing with that with my son, so and struggling with school systems.
Yeah, so actually, prior to the work that I'm doing now with adults, I spent about 30 years in pediatrics. And so I was maybe at the tail end of that at the point that I took IHeLp. But that being said, there's, for example, I studied Qigong sensory therapy, which has actually a great body of research in working with young children. It was a form of massage that has a great body of research related to improvements in that area, and also just supporting parent and child bonding. I did breathing techniques with kids. I incorporated guided visualization and meditation things with kids, because I specialized a lot in sensory processing and play-based therapy. I had a lot of leeway to incorporate all kinds of things into play. Most often I would have parents with me and participating in the sessions. So this was really good because I really focused on how do we regulate our own systems in order to be there for our children, which is absolutely huge. So I do think there's a big window of how to do that. A lot of therapists working on that also are working on like some of the listening programs that do polyvagal stimulation. So there's a lot of room for those kinds of approaches in that part of the field. I think just quickly to highlight what both Sandra and Monica have brought up, I think what's really valuable is the evidence-based approach that IHeLp reinforces. So what was really great for me is that when I started to incorporate these things into practices with children and with parents, like oftentimes together, I could look at what's the research? What does it tell us about meditative movement? What does it tell us about breathing? This isn't just like one more little hokey thing I'm like throwing in as an OT. It's got evidence behind it. So.
Yeah, great points. Thank you, Deborah, for sharing. And Andrea, I'll just let you know that at the end of this month, we'll be releasing our latest updated standalone course for pediatrics, for neuropediatrics, covering autism, ADHD, and now it'll also include epilepsy. So if that is something of interest, it's not taught in our IHeLp program, but we do have some courses that are just available to enroll in for CME and CNE, and that's one of them that we've focused on for peds. Yeah, Monica.
Just real quick, I took that course a number of years ago, and I thought it was a great course. It was really fantastic course. So it's a great way to introduce yourself into the Andrew Weil network of all the things that they offer. So I was actually just looking it up.
I was just like, I'll find a link. It's just, I'm just gonna encourage it not to enroll until the end of the month because we literally we just got CME approval on the
Right.
update. But we'll put a link in the chat for sure, so you can learn more about it. And then you'll see from the catalog other options, and that might be a great thing for some folks we have a couple free courses. You know, if you're just like, well, what is this online learning going to be like? Now, obviously, IHeLp is more encompassing than just taking the online courses. But it's a great first step for sure. All right, other questions for our panelists? Right. Well, what I'm going to do is I'm going to do just a few slides to give a little background on IHeLp, anything that we didn't touch on in our discussions and some important dates, and just a thank you for coming. You will get a app fee waiver code from Morgan.
Molly,
Yeah.
sorry to interrupt real quick. Andrea has one more question for us, it looks
Sorry.
like.
Oh, I missed that. Sorry. Yes, please. And I'll look for the free course links. Go ahead, Andrea.
I'm sorry, I'm your troublemaker tonight.
Not at all.
But I'm very curious and I'm very intrigued about this. So I can't, like, it makes me very excited. And I think because I've encountered a lot of this here lately myself, so had no idea there was a program out here about this. My question I think is how, because I've heard a lot of you have started your own practices. How did you decide to do your own practice? And how do you integrate that into different organizations or with the evidence base?
Who wants to take a first stab at that? Go ahead, Sandy.
Well, and maybe it's more for Deborah. I opened a private practice as a PT because I got tired of guys telling me how to do my job or how many units of service I needed to produce. And I didn't feel like that was what it was about. So an OT colleague of mine who's a CHT and she had owned her private practice. Her hand doc was phasing out. So we just kind of decided to go for it. But it was sort of like, typical Iowa, if you build it, they will come. I started with myself and a hand therapist and one other friend who was going to work a few hours a week. And people came to me and wanted to work here because it is about self-care first. If we take care of ourselves and we take care of our families, that allows more of us to be able to be the best healers that we can be, because everybody in my space is experienced. They have advanced practice skills. They are true healers. And we need to be appreciated, and we need to be able to take care of ourselves and be in a healing environment. And so maybe that doesn't answer the question, but it's a matter of just do it. And you know what? We're financially viable. I don't ever tell anybody anything about productivity or how to bill or what to do. And we're fine. This is just celebrate our 7th anniversary now. And we've grown to where I can't fit anybody else in. I don't have any more rooms. So anyway, Deb.
I think ditto to some of what Sandra said. I felt I wanted the flexibility to really be able to give the time I needed to clients. And sometimes that meant giving away some of my time and my services. I wanted the flexibility to be not only in a clinic environment, but to go to someone's home if I needed to, or meet them in a park or a grocery store. So, I did those things, and I was able to bill for portions of them. And I wanted a multidisciplinary approach, and there are lots of that approaches out there. At the time that I first began my private clinic practice in peds, it was in 2010 or 11, and I partnered with a psychologist, and because we felt like we needed both those components for mostly everybody walking in the door. So it gave me a lot more flexibility, I would say, and that was the biggest part of it. That being said, we still operate, many of us, within an insurance-based system that has its own challenges, although I've tried personally to get creative about how we structured payment at our clinic and in any way that I can, so that people had more options. Now it's just one-on-one consulting. It's not a clinic. It's even simpler in my life. But yeah, that's how it went for me.
Thanks for sharing more. I noticed that I missed an earlier question in the chat, and I think it is an interesting topic. Rebecca asked, can we chat about whether there are limitations to consulting patients about supplementation? She says, I'm in Arizona. Thanks for the wonderful discussion. I completed all the courses for functional medicine for the Institute for Functional Medicine. We should probably have her give the definition of functional medicine.
Right,
I didn't know about your program. But I think it's a really good point. You know, when we're teaching, the objectives in the and IHeLp aren't that you will be prescribing supplements, but it is that you will have a rich understanding of like which supplements, which micronutrients can positively influence health, and both in a promotion and in addressing chronic illness, and that to be able to educate and inform and provide that, as well as like saying, just like we talked about referrals, hey, why don't you go talk to your primary care provider about these things, or hey, I am connected with this nutritionist, and this seems to be like you need deeper support on these certain things, versus hey, it's a healthier lifestyle approach to be thinking about anti-inflammatory foods that you could be adding to your diet, or you know, gosh, what a magnesium can make a world of difference to folks who have headaches. You know, what was that? Well, here's some handouts with the evidence and the information, and maybe you should, you know, make sure you're checking people about all those interactions that can occur, right?
So also I've kind of looked into this from the PT's perspective, because even though we've got this certificate, it still isn't like you have a right to tell people what to take. But people have questions all the time, and I'm happy to chat with them about it. And one of the ways we actually had an integrative health pharmacist in town for a while, and so it was so awesome. I could talk about things that I thought would maybe help and then shoot them over there, but apparently she got told what to do and isn't really doing that. She's not around anymore, but you know, I think it was taking too much time. But what I'd like to say is that all of these discussions on health and helping your patients get better can be built under patient education. And then my safety valve with that is that we've talked about these things. I would advise you to go to your pharmacist or your primary care physician and see if these are right for you.
Yeah.
It's sort of a cop-out, but it allows you to spend that time with them and then still have the safety of, I didn't say you have to take this.
Yeah, I would add, so my husband is a physician assistant who went through the Integrative Health Fellowship. And one of the situations that he was in a lot when returning to family practice was all the other physicians would send their clients who had questions about their herbs and supplements to him, especially because they were concerned, because there are interactions. And oftentimes they don't know what their patients are taking, and the patients aren't, you know, and getting over the counter. And so Jim would have people with like big bags of things come in and look at them. And they also don't know necessarily where to source them and the quality of them. So there are lots of things to consider. However, as Sandra said, there's great information in the program about the supplements. You're always free to say, hey, this is what the evidence is suggesting, but in individual circumstances, you need to find somebody to help you with that. Unfortunately, it may or may not be their physician, depending on what they know, but that's definitely a start. Yeah.
Yeah. I would just clarify and add that we can educate, we can't prescribe.
Exactly.
Right.
Yeah.
On a medication, like someone's on meclizine for 4 months for something, and it's like that's going to impact their recovery. Tell them what to do, but we can educate and empower that patient. And like Deborah said, sometimes sending them back to the physician, nutrition is not required in medical school. I think it's still less than 20%. And for most of them, it's still an elective. And I know they're trying to make a change with that, which I think they're doing an amazing job because they are getting questions added to their board exams. But it's still not a focus. And the other thing just to add was I actually had a family member with some back pain and was taking a lot more calcium than probably they realized. So once we sat down and looked at, you're taking the calcium here and you're taking it in your multi and you're taking it with your vitamin D, it was way too much. And he had small kidney stones. So I'm not saying that it wasn't also mechanical, but there was another component. And so also knowing not what to educate them about, but to consider taking, but maybe we should look at limiting something that might be way over the amount appropriate.
Yeah, really good point. And it's another, have an integrative physician, nurse practitioner, PA in your referral contacts for sure. And also just like I love, like we have pharmacists that come to IHeLp. We do have a clinician level NPPAs coming in. And just like that, we're all at least thinking about these things. We have the resources. You guys know we provide access to external resources for you to stay up to date. What's the latest, that the research is showing, or the levels of evidence for these different products even. So like you can have information, you can be informed, and you can inform your patients and clients, and also to do that next step. So it's really really great question, and I'm glad Morgan, thanks for pointing out that I missed that. Thanks, Rebecca, for asking. All right, any other questions? We have 2 more minutes, and I'm not going to go to my slide. I'm just going to let you know that Morgan is going to email you all who are attending, give you some key dates, like when, if you're interested in applying, you should do it, before October 24th.
27th.
27th, close. Okay. Because you'll save a significant amount on the holding fee. And you'll also be in that window to apply for scholarships if that's something that is of interest. And there's no real risk in applying because she's going to give you that app fee waiver for our cohort that starts in January, late January online. But we have Q&As where I'll actually go through all the details of the curriculum and the structure and the requirements. And if you want to hear me talk, Morgan will include the next couple upcoming Q&As that I'm giving. But I'm just so grateful, Deborah, Sandy, Monica. I loved just hearing about what's going on in your life. You're spending time here to share that. Thank you so, so much.
This even made me more excited to go back in and dive into some more stuff. So it was fun to connect. Thanks everybody for coming in.
Thank you, everyone. Yes.
Thank you.
Thank you. All right. Have a wonderful evening.
You too.
Take care.
Thanks, everybody. Thank you to our wonderful panelists. Thank you, ladies, for taking time out of your day today. This was wonderful. It's so good to see all of you.
Our pleasure.
Thanks.
Take care.